Small?
Yeah.
Okay. Now?
Now it's clear, sir.
Okay. I am from Saudi Arabia. I think there is something in the voice. Double. Or it is good for you. Hello?
Hello?
You can hear me good?
Yeah, I can hear your voice.
Okay. But I hear it
Can you
twice.
turn your video on? So we
It
can
is
see.
not clear.
No, video is not there. Slides are there. I want to see you.
No, I will present only my lecture.
Okay, no problem. You can carry on.
Okay.
You can start your session.
I am from Saudi Arabia, the country that all Muslim directed to it every day. Hope our God save our country and all the countries in all the world from disease, from war, from drugs, from any bad things. My talk about a new alternative medicine can cause selective cell death in cancer cells without affecting the normal cell. My name is Fatin Khorshid. I am professor of cell engineering and in biology department, Faculty of Science, King Abdulaziz University, Jeddah. I am also the head of tissue culture unit, King Fahad Medical Research Center. This research have a lot of people work on it, more than 100 staff of co-investigators from all subjects, medicine, basic science, and pharmacology, many subjects. Most of our work were done at tissue culture unit at Fahad Medical Research Center. Some were done at core lab in KAUST University, some in Faqih Hospital, and some in Egypt in National Cancer Institute, and some in Visra company in Egypt, other also in Hygiene Lab in Germany. I will give some hint about this work because the publication you can find it full text at ResearchGate. The background of this research that we studied the fresh camel urine as it is, and then we fractionation the active ingredient and studied it on the studied the effect of it on the cancers and on the virus. Actual work started in 2004. And the whole work funded by King Abdulaziz University and approved by Ethical Committee of Scientific Research in King Abdulaziz University 3 times. First time to apply for cells and animal models, and second time to apply for human as healthy volunteers, and third time to apply for human as a patient, as a clinical trial. Also, this work funded by Al-Zamil as a scientific chair. We have a pending patent and we have, alhamdulillah, granted patent. The granted patent at GCC office and also Europe patent covered most of Europe countries as UK and Turkey and Spain, many countries. And also we have United States patent. We have a lot of awards also as a gold medal in Saudi Arabia and in Malaysia, and gold medal also in ITEX in Malaysia, and a lot of wards around our country and also around Asia. What is the scientific protocol of our work? We followed the international protocol for any new drug from National Cancer Institute. That's to study the investigated material in vitro, then in vivo, then as preclinical studies, safety, and then as a clinical trial on human. We started with camel urine fresh as it is. We call it BM701. We studied the camel urine in vitro, then in vivo, the effect of it on cancer and safety of the engulfing camel urine or drinking camel urine in preclinical in vivo also. After that, we make it lyophilized powder, as a powder. We studied it in vitro, repeat, then in vivo, efficiency, then preclinical safety. Then we fractionation it to mini fraction. We chose the effective fraction and studied the effect in vitro. We repeat, in vivo, and also preclinical. Also, we started the clinical trial with a fraction as a capsule. What is our result? For fresh camel urine, we use it. We found it affect. Of course, we first safety evidence for this usage from from other chemicals not used, or avoid chemicals from chemical hazard or microbial hazard. It's safe for use as it is, as it's fresh. Then we studied the BM camel urine on cancer cells in vitro in the culture cancer cells. Then we try to induce cancer in mice with leukemic cells and treated it with camel urine. We confirmed our result in another place from Fatin Hospital lab, and as a double check. Then we'll try to make pharmaceutical manufacturing for this camel urine. This is some of our result. This is lung cancer cells, A549. We can see this is culture cells to 24 hours. This is the plain cells without our investigated material. We can see it's 24-hour field Petri dish, and this cutted cells, this treated cells. Here we can see the treated cells. You can see hydropic degeneration. The cells become as a cluster and lose its internal structure. You see here polyps of water. Here as a clusters of cells lose communication and lose internal structure as clear organelles or nucleus. In same time, the treated normal cell, not cancer cells, of course, we cannot take from lung normal cells, but we take from skin after any operation to excite any area. As we can see here, 24 hours and 72 hours culture fibroblast with normal organelles. We can see the nucleus, cytoskeleton, communication between cells, and here after 22 hours, normal cells and normal, maybe influencing cells also. This is normal cells in our media. It's in cancer cells. Here we can see leukemic, another. The lung cancer cells, adhesive cells to the cultural surface. But the leukemic cells, it's suspension cells. And the cell here, as we can see, this is non-treated cells. We can see the size of the cells normal of leukemic cells L1 to 10, but after treated, it's the cell becomes shrinkage and condensation of the chromatin, and this is signs of apoptosis. By counting of cells, we can see we started in the same number for leukemic. This is mini concentration of our material. This is the higher, and this is the lower concentration. Comparing with the control, we can see the cells appear here in counting. We have this two. This is the control, and this is the ideal concentration. We can see at the beginning it's become to grow the number of cells, but later, comparing with the control, the number of cells become less. Sorry, this is the control. And we see the two ideal. Of course, the very high toxic for normal and for, but the ideal comparing with the control become less. This is the normal fibroblast. This is cancer, lung cancer and leukemic, but the normal we can see the curve gradually grow normally, not like here up and down, and only the growth in the control. In the animal models, we injected mice with the leukemic cells. Here, this mice without treatment, like cannot move and with a huge abdomen and very secure mice, inoculated with leukemic cells, but treated after 7 days. It's normally in movement and all it's engulfing food normal and appetite normal, everything normal. This is control, not received the cancer, but only received our treatment. It's also normal. There is metastatic changes in the organs of the animals. When we open this, the non-treated cancer, but non-treated, we think there is muscular sheet or muscular tissue thick, but we found it metastasis and acidic fluids, all with many tumors inside the organs. All this acidic fluid. For that one treated cancer, then treated, included with cancer and treated, it is normal skin or muscular tissue with normal very little tumors inside. For the lifespan, we decided to finish our experiment in 2 months. That means we included some special number of leukemic cells to finish our experiment in 2 months. This animals non-treated, the blue color, and the purple color treated with our vinculated with cancer, then treated with our drug. As we see here, of course, the number become a decrease for all both, that we make we kill them to investigate the tissues in the internal structure. Here the non-treated but cancered, and here treated and cancer. As we can say, the non-treated finish in our period. In 2 months they are finished. but the treated still with us till 5 months or more. Why we try to make manufacturing for this? In Arab countries, always they drink, Arab people, they drink the camel urine for treatment of many disease. We ask them what is the quality or what is the amount they drink. They said 100 ml. Between 100, from our investigation between animals in vitro and in vivo, we find the ideal concentration between, of course, we transfer it to human, we find it between 100, the less, and the maximum 300 ml. If we manufacture this 100, the less, to capsule, to transfer it to powder and put it in capsule, we found it 64 capsule. 64 capsule is very, this is daily, because this 100 ml give us 20 gram of powder. And we feel it in capsule, we found it 64 capsule. This is too much amount for normal, not for a patient also. That's why we extracted by 7 methods till we find the active ingredient. Active ingredient, we call it PMF, from Profit Medicine Formula. It's 150 milligram per 1 gram of powder, and it gives us from 7 to 10 capsule according to the concentration of capsule, 25 milligram to 500 milligram. Then also we make another fractionation, separation PMF to mini fraction, and it gives, sorry, it gives us 2 parts. The beginning give us 5 to 7 capsule, then give us 2 capsule daily, and this is acceptable amount for a patient. We, of course, the fraction, examine the fraction and examine the powder on 7 types of cancer cells, the lines, and also we examine the MTD, LDF, LD50, lethal dose on animal models as a preclinical and psychological studies. We covered all. Here some, this one, non-treated cancer cells, lung cancer cells. The non-treated, of course, the curve too high, and this is the ideal. The higher and the higher dose and the lowest dose, we can see the cancer cells number decrease. Here, the normal cells, we can see the control, non-treated, with the 2 concentration. This concentration, of course, 2 microgram from BMF and 20 microgram. This is for cells, not for a human, of course. As we can see here, the non-treated comparing with treated, the petri dish, we can see the plain area. It is that cells treated with BMF. Here, the part of the fraction, it have large molecule and small molecule. We investigated it also. What is the work done on lung cancer cells, on leukemic cells, on breast cancer cells, and on skin cancer cells? This is at Jeddah at King's Abdulaziz University. Also, we repeated it at National Cancer Institute in Egypt. Also, colon cancer cell line and human glioma cell lines, HIP-G2 cell lines. This all repeated twice, one in Cairo and one in Jeddah. Then we investigated some viruses some if it's a model for hepatovirus, and also in Germany H1N1, and the model for corona MERS virus. Viruses, hepatitis, and H1N1. This is the preclinical studies as a safety. We included cancer, skin cancer from operation room from a human. We sutures it in the ear. After 1 year, it make a big tumor in the animal, and also metastasis in internal organs. And this preclinicals as a safety only. This only take our drug without cancer. This received the normal dose and 20-time dose and 30-time dose. As we can see, normal and double dose, 10-time dose, 20-time dose, 30-time dose, comparing with a control, there is nothing on the CBC analysis. This is for acute toxicity. Also on the kidney and liver function, there is not big difference with all doses. On 2 types of animals, mice and rat. This is the acute toxicity. Control a normal dose 3 times daily for longer time. We can see there is no toxicity only on CBC, or also in liver or kidney function. Maybe uric acid decrease a little bit, and chloride decrease a little bit. Here the acute and liver function again, and kidney function. Okay, what is the structure? We study the structure of our drug PMF by Raman microscopy. We found it consists of many nanoparticles with TERF, also the electron microscopy. We can see the core here and the shell of nanoparticles. The nanoparticles of the core between 23 something to 57 nanometer, and the shell from 16 to 22 nanometer, many size and many shape also. Some of them the shell white, and some of them the shell black. No, this is the black shell, and this is the white shell, and this is the core, and this is the shell, and all scientific studies for drugs of nanoparticles make artificial shell, but here we found it normally, the core and the shell normally in our material PMF. Here we can see it also. Here inside the cell, we inoculated it, and then we take electron microscopy. This is the lysosome, and this is our nanoparticles surrounded the lysosome, and also inside the mitochondria, cause mitochondria to swollen and become unusable mitochondria. Here, look to the nanoparticle around after finish from organelles outside, try to enter to inside the nucleus, around the nucleus, start. Here make artificial pores in the nuclear membrane to enter inside the nucleus. This is the artificial pore to enter inside the nucleus. What happened inside the nucleus? We studied the DNA fragmentation and found this is the control one, no fragmentation. and this is after 5 minutes, 15 minutes, 13 seconds, 1 minute, and 2 minutes, all make fermentation for DNA by studied tunnel. This is the control one for many types of cancer. We studied A549, MG2, and colon cancer, liver cancer, leukemic cancer, and breast cancer. We can see all of them without any fragmentation of the DNA. The treated cell, there is a bright color and tunnel. That means there is fragmentation of DNA. This is the structure of our material PMF. We found it consists of large molecules as the creatinine, hippuric acid, and benzoic acid. All this also have amino acid as glycine, alanine, and arginine. This is the most common structure in it. It have also glucose and hippuric acid, benzoic acid.
Excuse me, Dr. Fatin.
Also.
Hello.
Yes.
You are running over time, ma'am. Please, can you finish up within few minutes?
Okay.
Thank you.
This is estrogen consist. It's very rare, and this is the minerals. The core consists of minerals. What is the minerals? It consists of gold also. Have a gold and have potassium, of course, most, sodium and iron and zinc, used many materials, including silver and gold. Here we can see the investigation of all the type of cells by PMF. This is the MG2, and this is the colon cancer. This is brain cancer and breast cancer and lung cancer, comparing with vero cells, with the small minerals and protein. This is the investigation on the coronaviruses. We can see here, of course, this is a model of corona, and this is the control non-treated, comparing with treated for virus reduction in the time, H1N1. This is the control comparing with the model of virus. Here on the hepatitis also, this is model control comparing with the number of viruses after treatment. This is our production from all this BMF. And this is the clinical trial on healthy volunteers. There is no effect of bad effect on lung cancer or CBC or liver cancer. And this is approved by ethical approval. And it's already published. This is for topical. We can see here after psoriasis patient after before and after 3 months. And this published already also. This is eczema, severe eczema after 3 months by our topical investigation. This is severe eczema also. This is fetal LIGO after 4 weeks, according to her doctor. This is psoriasis. Also, it's give good result in MS. In MS, the patient take this capsule, find very nice result in posture, in movement, and in vision, and in all their health. This is all patient of MS. This is our CARES report on the lung cancer patient, and it's published already. And this is our publication. I would like to thank my family and my university, and I thank you and thank for the audience all. Thank for God. This is my social media. You can find on YouTube all the lectures and my email. Thank you.
Thank you, Professor Fatin. Excellent presentation and innovative ideas. Maybe more studies